Okay, so for our next Q&A for our VICTA Science Fair, we are with Florentina Sava, who is a clinical scientist in genomics. You came through us through the Royal College of Pathology, so thank you very much for taking the time out to talk to us. Perhaps you could tell us a little bit more about who you are and what you do.
Hello, everyone. I'm Flori, and thank you so much for having me today. And as Luke mentioned, I'm a clinical scientist in genomics, indeed. And that means basically my main role is to analyze and to interpret genomic data from patients with different conditions. And at the moment, I'm in the cancer team. So this means that most of my clinical work is focused on somatic cancer. And in particular, at the moment, I'm working with patients that have myelodysplastic syndrome. This is one of the acquired syndromes, which means, in general terms, that the blood cells do not mature. And they do not, therefore, they do not get to produce healthy blood cells. And sometimes they can also be dysplastic. They can have different changes, and they can further travel to the bloodstream and lead to cancer, basically. And the main symptoms these patients have is weakness. They have recurrent infections, and they can also have blood cell abnormalities in their blood cells. Like the values can be quite low or quite high.
Yeah.
And that would be an example of the cancer that I'm currently working on. And how do I analyze this data is by using different type of technologies. For example, one is called SNP array, and this allows you to look at different changes in this patient's genome, and you can detect large deletions or duplications of specific regions within the genome, and sometimes can involve one chromosome or multiple chromosomes, depending on the type of cancer and how far the cancer in the patient spread. So it can be different from patient to patient. Every patient is different.
Yeah.
No patient is the same. So that's why it's so unique and exciting to work in this field, because you can never get bored, let's say that way, because you always have an interesting case to look at and exciting for your learning.
Yeah. No, it sounds like quite intense and quite important work, really, what you're doing, because being able to detect those cells is incredibly important. And you said, not every patient's different, but what might an average day or week really look like for you if you've got different caseloads going on? What might an average sort of week look like for you?
Yeah, so every day is different. Every week is different. And in my role, so a week can involve several activities. So besides the clinical data, by analyzing and interpreting and writing complex reports, because the majority of reports in cancer patients are quite complex. They have different abnormalities, and sometimes it's very difficult to interpret them. And of course, these are very important for the patients because based on their changes, they will receive the appropriate treatment. So besides that, I'm also involved in the data scientist role. That sounds a bit strange, maybe, and does not say much. But what this means is that I triage all the samples that come into our laboratory, and samples that are referred for hemato-oncology related conditions. So I check that all the documents are correct. and they match with that patient sample. And I also take the decision what type of sample we need from this patient. For example, if we need DNA, or if we need RNA, or if we need to store cultures for further testing, then I do that. And sometimes I also take the decision if to activate any testing at that time when the sample arrived in the lab at that exact time, or if to activate it later on after the DNA or RNA is extracted, and all the patient data is introduced in our database, and take it for then take it further by other colleagues. So that's one of the roles that I do every week. I do one afternoon. Sometimes I also provide training to other colleagues, and also to scientist trainees, which these scientist trainees are part of the STP program, which is scientific training program, and it's a 3-year work learning program. And you also you also gain a master's degree at the end of this program. So besides becoming a clinical scientist, you become you also gain a master's degree.
Yeah.
And yeah, then I also take part in different meetings, team meetings, or also CPD meetings, and these are either given by different healthcare professionals that we invite to give us a talk about specific topics that we are interested in.
Yeah.
Or ourselves, we give a talk about a specific topic, more like a journal club, something like that, either reviewing a paper or discussing a very complex clinical case that we came across during our work. And then other role would be to answer phone calls that we receive from different doctors and nurses and other healthcare professionals, inquiring about their results of their patients, but also asking us to initiate specific testing for their patients. And of course, answering emails, lots of emails all the time, a lot of traffic with the emails, either between our colleagues, between us, or with other labs, with colleagues from other laboratories across the country, or even from other countries. Sometimes we are contacted to provide testing for international patients. So we have to do that as well. And what other roles? It can be quite different. Also attending meetings before the lockdown, before the current situation, we used to attend physically, which was quite exciting, especially if you would have to travel to other countries to attend that meeting. But now everything it's online, but it's still exciting because you learn a lot and you can still communicate with other colleagues from other parts of the world, of course, virtually.
Yeah. Where have you had to travel so far with this job then? Have you had to travel anywhere far with this job?
Yeah, quite a lot. So if you're a scientist, you have to like to travel indeed. So I went to a few continents and several countries. So I went to Australia, for example, for a conference.
Wow.
4 years ago. And then I also went to Europe, to many countries, to Austria, to Spain, to Finland, to Norway, to to Bulgaria, to what else? Switzerland.
It sounds like quite a few opportunities that come out of it, really.
Yeah, and America, of course, United States, in Boston, and other cities, Oklahoma.
It sounds like
and
everything that you've just described, with all the different components and all the different parts to your role. It's not a career that you just go into hoping for the best. You have to. There's a lot of studying and planning and effort that goes into where you are right now, what was your route into the career you're in now? So what subjects at school were important for you to study? What made you sort of follow this path? What was your interest in following this route into where you are now?
Yeah, so I was always interested in medicine, everything that is related to human care, basically. But it was quite a bit challenging for me to get into medicine because of the situation at the time when I decided to join decided to go to the university. So I did in the end I did a bachelor's in biology, and then I did a master's in human molecular genetics. And after that, so it was quite a long journey. I also worked as I did research after my master's at the University of Barcelona in the same research group where I did my master's, actually. Because I liked the topic so much that I continued that work after my master's. So it was it's quite interesting because that work was about the identification of a possible function of a gene that is involved in retinal disorders, actually, that leads to blindness. And this gene is called CERCAL and was identified by the research group that I did my master's, where I was working. And we knew at the time that when there are different changes, pathogenic mutations, we call them, in this gene, it leads to retinal disorders. And one of them is called retinitis pigmentosa. And it's a neurodegenerative disorder that leads to blindness. Mm. So you end up either seeing like in a tunnel, or you just have peripheric vision. And people start to get affected from in their 30s, basically, or some people even earlier, and then they become blind. So it was quite an interesting project. So I stayed there a few years and tried to do as much as I tried to work as much as possible on this topic. And then I also went to United States, actually, with an internship on the same topic. And then I joined the research group at the medical school in Budapest. And that's where I did my PhD. And my PhD was quite different than compared to my master's and what I'm doing now. It was more focused on the immune system of premature neonates. So I had to characterize their immune system of these premature babies when their mothers have different complications during pregnancy. Complications like preeclampsia or vitamin D insufficiency or premature rupture of membranes and other complications. So I was looking to see how their immune system is affected and to see if I can find a marker or like a pattern, and hopefully to help them, because these premature neonates, these premature babies, they end up with different complications during their lifetime. So it's quite a difficult situation for parents. So I did that, and right before finishing my PhD, I joined the lab here in Birmingham, where I am at the moment at the Women's Hospital. And I joined as a trainee, as a pre-reg clinical scientist, and that's where I did all my training for the role I currently have. And that meant to do to do all kind of tasks. I was so keen to learn as much as possible and to register and become a clinical scientist. And I spent 2 years there. And that meant writing a portfolio and submitting it to the Association of Clinical Scientists. And then they assess it and they invite you for an interview. And if you are successful, then they give you a certificate of attainment. And that enables you to register with the Healthcare Professions Council. And that's when you become a clinical scientist. Right after I finished my registration, I then went to London to Great Ormond Street Hospital for Children as a registered clinical scientist. And I worked in the core team, they call it, which is to provide diagnostic to familial cancer, to patients with familial cancer, but also to different common or rare disorders like familial hypercholesterolemia or deafness and other conditions. And then I came back to Birmingham, in the same lab where I did my training and where I am at the moment. And because of various reasons, mostly personal, personal reasons. And before moving to London, I was working in the rare disease team, and now I work in the somatic cancer team.
Right.
So I provide different type of diagnosis, genetic diagnosis, different type of workload.
Is that where you want to stay, or do you want to move into other areas? What's your next move? What's your plan?
Yeah, so at the moment I would like to stay here for a few years, and that's because I would like to do the FRC path examinations. I'll do the first one, and then if successful, hopefully I'll then go maybe for the second part, because if in my role you can become a consultant clinical scientist, so it's similar level as for doctors. You can be a consultant in pediatrics or neurology. It's the same. We have higher specializations, so you can become a consultant clinical scientist, and for that you need to pass 2 exams. It's part 1, which is from the Royal College of Pathologists, and which is a written exam. And then the second part is an oral exam, and also a project. You have to write a project. And if you are successful, if there's any opportunity, any role as a consultant clinical scientist, then you can apply for it. And yeah, if you are successful. Yeah, so I would like to do that. So at the moment, for now, I plan to stay here in the same team, but I would like to rotate, because there are still other areas in genomics that I did not work in previously, like prenatal. I'd be very interested to learn a lot about prenatal testing. And also, I don't have any experience in tumor testing, so that would be another area where I would like to work. But the lab here in Birmingham is very big. We have so many opportunities and so many teams that you can move to a different team and you would feel like you are in a different lab. You wouldn't feel like you are in the same, so you would not get bored. It would be something completely new for you. So yeah,
that's quite a nice environment to be in, where it does feel like it's new like that. No, that's really nice. It's been absolutely fascinating to hear all about it. I suppose my final question would be, for any young person that was thinking of doing something similar and following a similar career path, what would be your advice to them? Because it sounds like everything that you've just said, there's such a commitment to it, but also so rewarding with all the different opportunities available to it. What would be your advice to any young person looking to follow a similar career path?
Yeah, so it is very rewarding indeed. It is rewarding because first you, at least in my field, you help the public, who can be a patient or even a lay person, lay public. It can be anyone helping with an advice about the disorder. If there's a disorder in the family and they would like to know more about genetics and how they can get help, and directly, of course, by providing genetic diagnostic in a lab like the one I'm working at the moment. So it's very, very rewarding, because you can see the impact, especially when a patient starts to receive the appropriate treatment, and then they get better and they have a healthy life, even having been diagnosed with cancer. So you can live like you can have a normal life, even if you had the diagnosis of cancer these days. And yeah, it's very rewarding because of that, but also because you get to learn skills that help you during your whole life. You learn lots of skills that help you at home or in difficult situations that life puts you in. So it's very rewarding because of that too. So it's a lot to learn or to commit to indeed, but if you like it, you would feel like it's a hobby more than a job. uh, and you really have to like it. And even if you have difficulties, I had lots of, for example, financial difficulties at the start of my career, and also psychological difficulties because my family was not in the position to support me whenever I was down, or when I would fail something, or when I felt alone by living in a different country, or moving to a different city and not having my friends with me, and finding all kind like meeting all kind of different people, and some of them are very kind and some less. And it's been very challenging, but if you really like it, I would definitely recommend everyone to do whatever they can in their power. And you will see that at some point, at least that's what I felt, that when I wanted something so hard, like so badly, that was linked to my career, I felt like everyone was contributing to it to help me and achieve that goal. So it felt very special. It felt very good to see that in the end, if you really like something, it can yeah, it can happen, becomes true. So it's good to have high hopes, high dreams, let's say like that, because you can never know when they can become true, basically. So I would definitely recommend them. And there are so many routes that you can take to work in science. We have lots of internships, for example, in our lab. We have apprenticeships that they pay you for it, basically, and you can work the same amount of time hours as any other colleague of ours. And they train you, they provide you all the training you need. You don't have to fear that if you don't know anything, or you don't know something, you are not able to do it, or they won't accept you. Now everyone works for the same goal, which is towards healthcare, patient healthcare, like to provide quality diagnostic care, and everyone is passionate about it, and everyone is so keen to teach you. For example, when I came back from London, I did not know anything about hemato-oncology. For me, it was abstract. I did not know anything, and I did make that very clear that I'm happy for you to move me in that department, but I don't know anything about it. So if you could help me and provide me some training. And they were so happy to teach me everything they know, and to show me where they have all the resources, how to interpret complex cases, and so on. So they were very happy to help me. And now I have quite a lot of competencies. I actually had my annual review with my line manager 2 weeks ago, and she wrote many kind words by saying I did not know anything when she joined, but now she has quite a big number of competencies. So she's been going through lots of training. So they were also scared that having someone new without any knowledge in this field, how would they teach me what I need to know and to actually do the tasks that I'm hired to do. So they will help you, and they adapt to you, and they give you space and time
So the
to
opportunity to
learn.
progress is quite,
Mm.
you can progress quite quickly, by the sounds of it.
Yeah, so yeah, go for it. Even with any obstacles you have, or any difficulties, or fears, or worries, or whatever happens, just go for it. And if you need help, ask for help. People will help you no matter what. And if there are some specific barriers, they will always adapt to you, and they will do whatever they can to make you feel like a part of a team, of the team, basically.
I think that's a lovely note to end on. Thank you so much for speaking to us about your career and giving us your advice there. I think that's lovely. Thank you so much.
My pleasure, and thank you so much for having me and for giving me this opportunity. And I really hope that we'll have as many as many colleagues in genomics in the future, because it's really needed. It's really needed.